Gives your question. Okay, so if you've read and understood, considering 8 history taking station, please begin.
Yes, ma'am. Hi, I'm one of the surgical exam candidate here today. So may I confirm your name and age, please?
Um, Hi, my name is Graham and I'm 56 years old.
Nice to meet you, Graham. So I've been assigned to ask you a few questions regarding your condition, and I'll be taking notes of it if required. Is that all right with you?
Yeah, that's fine with me.
Yeah, thank you. And may I know how can I help you today?
So, your good name, doctor?
My name is Dr. Ashik.
Yeah, Dr. Ashik, so I have kind of lost my original nature.
All
So
right.
it's been there since few months.
Mm-hmm.
So that's why I've come here.
I'm very sorry to hear about it. And could you please elaborate? What did you lose? You can
Uh,
feel free to talk to me. The things will be confidential, so you can feel free to confess me.
okay. So, see, Dr. Ashik, I have two kids. Okay, previously I used to enjoy my marital life.
Mm-hmm.
Nowadays, mm, my wife is not happy with me.
All right, I can understand. I'm very sorry to hear that. And so, can I ask you a few questions regarding your condition? Is that all right?
Sure, you can.
Yeah. Okay. So, since how long you have been having this difficulty?
Um, it's been going on for probably 8 months, 7 to 8 months.
Okay. So, do you have pain?
Not exactly. I don't have any pain
Okay.
while.
And how did this happen? Whether it was gradual or it appeared suddenly.
No, as far as I remember, that was a transition. It didn't happen in one day.
All right. And do you have morning erections? And if so, whether it is how it is, whether it is reduced or increased.
Yeah, actually, what happens is um, in the morning, like around 4 or 5 a.m., I have normal erections. But when when I'm thinking of enjoying with my wife, at that point, probably nothing happens.
All right. I'll take a note of it. And is your erection sufficient enough for penetration?
Not exactly. That's what is bothering
All
me.
right. Okay. And do you get erections watching videos or pictures?
Uh, Maybe actually I haven't tried.
All right. Okay. And do you ejaculate prematurely?
Yes, nowadays since last 8 months it's been happening.
Okay. And anything that improves your erection? Do you know anything that improves or worsen your erection?
Maybe yeah, uh, probably it's all on my mood.
Okay.
So if I'm kind of feeling good, and if we have a good foreplay, maybe the erection is
All right.
better. If I'm
All right.
stressed, and,
Oh, yeah. All right. And have you ever noticed your penile shape, whether it is becoming, how is the curvature, whether it is unusual or it is bending?
um, actually, I haven't seen any bending like that, but
Mm-hmm.
it'll be good if you could examine it
All
by
right.
yourself.
Yeah, I'll do that. Thank you. And um, do you have any injuries while having intercourse?
No, nothing like that till now.
All right. Okay. Thank you. So, how are you feeling nowadays? And how is your work-life balance? Do you feel stressed, or how do you feel?
Actually, this thing is bothering me. I'm not able to enjoy my personal life
Okay.
because of
How's your work? How's your work balance? Do you feel stressed, or how do you feel?
actually the work has increased a bit. Maybe I'm not sure whether this is increase. This is the cause for this, but yeah, the work has increased. I do feel stressful at times.
Okay. Thank you. And how's your appetite and how's your sleep?
Appetite has been okay. It's been the same. Sleep is more or less the same.
Okay. And so, do you have the urge to have sexual intercourse? Like, do you have
Of
that urge?
course I do. Of course I do, doctor.
Okay. Okay. That's good. Thank you. And do you have any relationship problem with your partner?
Who doesn't have doctor? But not
Okay.
to that range. Yeah.
Thank you. Can you
All right.
summarize your history now, please?
Yes, I'm 56 years old male with the complaints of having erectile dysfunction, and he's not able. He's having this problem for almost 8 months, not associated with pain, and it was gradual and onset, and he is not able to have penetration and not able to satisfy his wife, and that's all,
So
ma'am.
what are
Then
your,
if
yes, what are your
if time would have permitted, I would have asked his personal history, his sexual history, his past family history, and I would have asked his illness regarding his systemic illness, and I would have asked his ideas, concern, expectation regarding his condition.
and medication history as well?
Yes, ma'am, my
What are
medication
your,
history.
yes, what are your provisional and differential diagnosis for him?
My provisional diagnosis would be psychological importance,
Yes.
drug use, and organic importance, ma'am.
All right. What investigations would you ask for to establish your diagnosis?
So to start with, I will do complete blood count, urea creatinine, liver function test, and I would ask for serum FSH, LH, and testosterone levels,
And
and urine analysis, ma'am. And I will check his
serum
diabetic status as well.
prolactin as well. Very
Prolactin, yes, ma'am,
important.
and serum
And
prolactin,
midstream
and
urine
yes,
analysis.
ma'am. Yes, urine analysis, ma'am. And I would do OST, that is office cylinder different test, to see how the erection and how is the penile curvature. And I will do an duplex ultrasound with injection with cavernous sinus with papaver.
All right. What treatment can you offer this gentleman?
Yes, I will stabilize his diabetic status, lipid, dyslipidemia, and his if there is any neurological disorder, I will correct it. I
Okay.
will lifestyle modification, like to reduce his stress, and um, I would ask him to stop smoking, and I'll
Yes.
ask him to reduce alcohol, and
If
I
he
would put the
drinks.
patient on.
If he drinks, you didn't ask if he drinks or not. Okay,
Yes,
thank
sir.
you. Can you
Thank
please
you.
tell me what is the biggest mistake you've made in this station,
Um,
which can cost a candidate a pass?
I'm not sure, ma'am.
Yes, I've repeatedly said that this is the only history taking station which requires that you ask for who?
Yeah,
Yes, ma'am.
Say it again. Who was answering?
chaperone.
Chaperone.
Yes. Right away, patient said, I've lost my nature. You should have raised a voice and you should have asked for, can I have a chaperone here? Because
All right, ma'am.
it's a very private nature of questioning that carried out between two people. And it can be in that sense that patient can feel himself embarrassed or offended. And in order to avoid that, and for the sake of the safety of the physicians or the consultants, it's important that chaperone should be there. And
Yeah,
then,
I'll take a note of it, ma'am. I was
yeah,
not aware. I'll take a note of it, ma'am.
yes, good. Thank you.
Ma'am,